Yeah, so thank you so much to everyone who is here joining us for our imposter syndrome workshop. Very grateful to all of you here, and thank you to Anise Health, who's partnering with us on this. And we have Dr. Sheetal Ajmani, who will also be speaking on this topic some more. So I'm very excited to hear from her and her expertise. Before we get started, I just want to give an introduction about Asian One for Health. Asian One for Health, we are a nonprofit who is dedicated to advancing Asian women's health and well-being through community engagement, education, and representation. So we have a lot of programming that is dedicated to sharing information about Asian women's health so that they can make more informed health decisions, and also ways to promote health equity, research equity, and data equity as well too. Before we get started on our presentation, I would like to share some COVID-19 vaccination, some updates so that we can all stay up to date and keep ourselves healthy. Right now, they are offering new booster shots at your local pharmacy. They did stop giving out the old booster shots. September 11th, I believe. So now you can get the new booster shots, and you can also receive both your COVID-19 booster shot and your flu shot during the same appointment. And for those who are uninsured, you can still get free COVID-19 vaccines at community health clinics, at mobile vaccination clinics, and at your local CVS or Walgreens pharmacy as well too. And definitely feel free to visit the CIC website for more information regarding the new vaccine, as well as any new upcoming vaccinations like the RSV or shingles, just to making sure that we are, being up to date and taking care of ourselves now that it is getting colder. But now I will pass it over to Dr. Sheetal Ajmani to share.
Great. Thank you so much, Sophia, for having us here today. It truly is such an honor for us to be able to collaborate on this event. I wanted to congratulate everyone for being here, for taking the time to show up for yourself. So just give a moment to send some good, warm wishes for yourself as well. Imposter syndrome is something that's often observed for people living as a minority in a majority culture, especially when we as people of Asian descent tend to come from cultures where perfectionism, the pursuit of perfectionism, is a value that is passed on between generations. So I imagine everyone here has felt this acutely in our own personal lives. And I just am glad that we're all showing up here today to talk about this topic. So as Sophia mentioned, we have the privilege and honor of hearing directly from Dr. Sheetal Ajmani. Dr. Ajmani wears many hats. She's a physician, an author, a speaker, the founder of the Radiant Living Institute, a medical advisor. And in a moment, I'll invite her to introduce herself, as she'll be facilitating today's workshop. To introduce myself, my name is Angel. I use she, her, hers pronouns. I lead partnerships and growth at Anise Health. Anise is a culturally responsive mental health platform built for and by the Asian community. So we provide integrated therapy, coaching, and curated digital resources dedicated for the Asian community. And I'll share a little bit more information about how we empower our community at the end of the session. But most importantly, just wanted to give space for Dr. Ajmani to introduce herself.
Thank you so much, Angel, and Sophia. Thank you both, and Asian Women for Health and Anise Health for the wonderful work that you're doing. It's such an honor to be partnering with you today. And so if we could go to the next slide, as I take a moment to continue to introduce myself, I wanted to hear from you in the chat box. So I really like to have engaging and interactive workshop. So I'm going to ask you to use the chat box. So as I move into introducing myself a bit, I would love to hear in the chat box, what about this topic specifically resonated with you to attend today? And what do you hope to gain or learn through today's workshop? My style of speaking and leading workshops is I have an agenda planned, and I like to always respond to who is in the room today. And so, especially for those of you who are able to show up live here today, definitely use that chat box, and I will keep checking it throughout the presentation to make sure that we're responding to that. So go ahead and start typing what about this topic resonated with you to attend, and what do you hope to gain or learn through today's session. And then if we could go to the next slide, I can take a moment to introduce myself as well while you are introducing yourself in the chat box. So as Angel mentioned, I am Dr. Sheetal Ajmani. I am a physician. I'm a trained pediatrician. And I practiced clinical medicine, clinical pediatrics for 16 years before I left in December, and am now focused fully on my company as the founder of Radiant Living Institute, where I guide people to get unstuck and learn to live radiantly again through an approach that combines Western and Eastern modalities of well-being and healing and recovery. I'm also the host of the Essential Self-Care podcast, and I am the co-author of the Amazon bestselling book, Doctoring Better. Now, when I was invited to give this talk, a story came to mind, and I want to share that story with you now, just a little bit of my own story, and then we'll go into a little bit more about what imposter syndrome really is, kind of the definitions of it, and then how you can navigate it and address imposter syndrome in your life. But the first thing that came to mind when I was invited to give this presentation was a story from my intern year of pediatrics. So I'd graduated medical school. I had the MD behind my name, and I was in my first year of internship in pediatric internship. So basically what that means is I graduated medical school, and now this was my first year of really on-the-job training, right? So I was working in the hospital, and I would, go into patient rooms, and I would introduce myself as to the parents. So since I'm a pediatrician, I'd introduce myself to the parents as Sheetal. I'd say, "Hi, I'm Sheetal. How's your child doing today?" Right? And now, granted, pediatrics is a bit more casual in field in terms of in medicine, in the sense that many pediatricians don't wear a white coat, because there's been studies that wearing a white coat can scare children and things like that. But still, I would go into the room and I would say, "Hi, I'm Sheetal. I'm the intern. How's your child doing?" And I would just go on like that. And about 1 to 2 months into my intern year, my senior resident said, "Sheetal, I need to talk to you." And I was like, "Uh-oh, what did I do?" And she said, "You really need to start introducing yourself when you go into patient rooms as Dr. Ajmani." And that was hard. That felt really, really hard because, I had just graduated medical school. So I've done all of the coursework, right? And in medical school, we have an 8-week pediatric rotation where we're seeing patients as a student. So really nothing that we write in the chart really counts. And then some electives. But now here, all of a sudden, I've graduated, I have an MD by my name, and I am in the hospital, and anything I write in the chart does matter, because that is the medication that's going to be given to the child, or that is the test that's going to be ordered for that child. Nurses are calling me, right? Parents are asking questions. So that was really hard, because it didn't, even though I had the qualifications, I had the education, right? And by all standards of how medical education is, I had every right to be there. I was fully qualified to be there, to be making those decisions, to be in that place, right? Yet it was so hard to introduce myself as Dr. Ajmani. And I'll be completely honest with you. Yes, I started doing it because I was advised to, and obviously it made sense. But I'll be completely honest with you. It took a few years of practicing, of really getting that clinical experience under my belt before I actually felt comfortable introducing myself in that way. So I just wanted to share that story. And certainly that's not the only time that I've felt some of these, felt imposter syndrome. It continues, and and that's why, we were originally, this talk, I believe, was going to be called Overcoming Imposter Syndrome. And as I was thinking about it, it's really addressing it, because even, the world's most successful people still have, many of them still even publicly said that they still have feelings of imposter syndrome. And part of it is we're human, we're continually growing, continually seeking that sort of next level of progress. And what that means is that we're continually putting ourselves into new situations that might feel uncomfortable, that we might not feel fully prepared for. in some way, shape, or form, right? So with that, let's go to the next slide. And I want to know, again, in the chat box, actually, if any of you can relate. And I see, I'm going to just kind of flip through the chat box here really quickly.
Yeah, Dr. Ajmani, with you sharing your story, I'm really proud of all of us. A lot of people have opened up, just sharing everything from personal struggles, how to advocate for ourselves, bringing it back to our immigrant identities, the people-pleasing natures, feeling like we need to prove our citizenship, limiting thoughts, even like seniority in like well-established organizations and disciplines that people have provided a lot of respect for. And I'm also seeing some comments at the end around how can we, spread the love to other members, peers, coworkers, colleagues. So I'm seeing like a lot of different angles to this.
Yeah, this is great. Yeah, I'm going through it now too. Thank you everyone for your openness. Thank you everyone for sharing as well. And we're definitely going to address a lot of these things that you have mentioned in here throughout the rest of the presentation. So thank you so much for that. All right, so let's get into some definitions first. So what is imposter syndrome anyway? So imposter syndrome is defined as self-doubt of intellect, skills, or accomplishments among high-achieving individuals. So this often is seen in individuals who are high-achieving already. These individuals cannot internalize their success and subsequently experience pervasive feelings of self-doubt, anxiety, depression, and/or apprehension of being exposed as a fraud in their work, despite verifiable and objective evidence of their successfulness. Now, imposter syndrome was first described in 1978 by Dr. Suzanne Imes and Dr. Pauline Clance, and they observed this syndrome in highly successful women. And what's interesting here specifically for this talk today is that the impact of things like systemic racism, classism, other biases was not taken into consideration in the study that they did, the initial study that they did with imposter syndrome. So many groups were excluded from this study, specifically women of color, people of various income levels, genders, and a variety of professional backgrounds. And so, I think, and Angel, you had mentioned that as one of the comments as well, of just kind of how this may affect us kind of, immigrant families or coming from immigrant families, there are a lot of perhaps, and I've certainly experienced it within my career, within my professional career, implicit biases, microaggressions, right, in the workplace, in the professional setting, even that make you feel like you don't belong, right? That can certainly contribute to this as well. There is no, I wanted to point out also, there is no DSM-5 criteria, DSM-5 like diagnosis of imposter syndrome, but this is a syndrome, characteristics that are often seen, and this is a term that we use, but it's not a specific like a medical diagnosis. If we could go to the next slide. Imposter syndrome tends to occur more commonly in females than males. As Angel mentioned earlier, it tends to occur more commonly in minority groups, students, as well as the workforce, particularly in high pressure, high stakes settings, such as healthcare. And then we wanted to touch on a little bit of the impact of recent events of the past few years with COVID-19 and the pandemic, and how that has also contributed to these feelings of imposter syndrome, right? So with the pandemic, while many people had the opportunity to work from home, work remotely, which may have had some benefits, you could maybe be in your pajamas most of the day if you wanted to, but it also created quite a bit of distance and isolation, right? Much harder to get sort of spontaneous feedback from colleagues when you're working at home, when everyone's working in their own home spaces, right? As opposed to what I would call, and I may be dating myself here by saying this, but what I would call those water cooler conversations, right? Where you just kind of bump into each other as you're walking down the hallway at work, or, walking by someone's desk. Hey, can I run this by you? And you're able to get a lot more of that real-time feedback, right? Also, things like virtual meetings, right? Where you're not able to kind of see that feedback from people on the other side of the screen often, right? And as well as the masks, of course, unable to kind of read that body language. And we know that a significant proportion of communication is done through nonverbal cues, right? I saw a variety of statistics when I was looking it up earlier, ranging from 55% to 93%, depending on where I was looking, of communication, which is from the nonverbal cues. So I didn't have a specific statistic I could share with you about that, but it is the majority, right, of your communication is through these nonverbal cues, which we are missing out a lot on through a lot of the changes that we've seen through the pandemic. And then I wanted to talk a little bit about some comorbidities. So often we can see anxiety and depression as well alongside with imposter syndrome, and it can easily lend itself towards burnout as well. So defining a little further imposter syndrome, it's often described as having these 6 characteristics. So I'm going to run through these one by one. So the first one being imposter cycle, which is characterized by 2 things, over-preparation and procrastination in response to an achievement-related task or goal. So you have a goal that you're working towards to achieve, and you may feel like you need to over-prepare. You may feel that you need to work harder than others to achieve the same goal, right? And or you may experience procrastination. And then where you feel like there's this sense that you may be found out because of your last minute preparations. And then this is followed by a failure to internalize, so not being able to internalize your success after you have achieved that goal or that task. Yeah. The next one is perfectionism. Perfectionism, placing these self-imposed, yes, this is often self-imposed, unattainable standards and goals, which can then lead to overworking, this sense of martyrdom, right? Of needing to sacrifice your needs to achieve this goal because it has to be just perfect. And then also of being overly critical of yourself, maybe being judgmental of yourself, right? Not finding that self-compassion as you meet these goals. These goals which you have set that are practically impossible to reach as well, right? Right. And then superheroism. That is over preparation related to the need to appear the best or more capable than others. And that leads to, again, putting additional workload on yourself, additional self-criticism and judgment, right? And then there is fear of failure. So feeling anxious or fearful of experiencing shame or feeling humiliated if you don't perform as well as others. And then there's a denial of competence. So discounting your own intelligence, experience, and skills. Yeah, very much how I described in my story earlier, right? I had the degree. By every measure of standards, I was qualified to be there, yet it was so hard to introduce myself as doctor. Fear of success. So again, able to internalize failure, but then unable to internalize success. So when there's failure, being able to internalize that, say, okay, that was my fault or whatever it may be, or not good, or wasn't good enough in this way or whatever it may be. But then when there's success or achievement, attributing that to external factors, things like luck. Oh, I was just lucky. I'm just so lucky, right? As opposed to giving yourself credit for any of that success, for having done anything for that, right? And part of that, I do think part of that is also culturally taught to us, right? To be humble, yeah. And so if we can go to the next slide here as well as we kind of lead into that, right? So being humble and maybe not maybe in some ways being taught to not take credit for all of that, right? Or not to showcase that or highlight it. And so I wanted to talk a little bit about imposter syndrome, specifically in immigrant families. And the slide shows some history. I'm not going to be going through that history specifically, but just we wanted to kind of depict imposter syndrome in immigrant families. You know, immigrant families have worked hard to fit in, right? I'm a first generation, right? My parents immigrated here. I'm the first person in my entire family to have been born in the US and raised here in the US. And so I can see this example and this journey too within my own family, right? Of working really hard to fit in and being faced with a lot of explicit and implicit bias, right? Maybe not seeing others that quite look like us in the workplace, right? Often, many immigrate to like rural areas because that's where there's more of a need and where some of the jobs are, right? And so then they're also lacking some of that diversity. We also have this cultural focus, as Angel said at the very beginning, on achievement, and that kind of perpetuates this sense of perfectionism as well. And also this cultural focus on, you know, I believe in many Asian families and cultures of maintaining the honor of the family, right? And so not revealing your imperfections or mistakes or shortcomings, right? To maintain the honor of the family. And that can also lend itself towards this perfectionism, or even towards not being able to open up in ways like we're doing today, which is why I'm so happy that you know, Anise Health, Asian Women for Health, that we're all coming together in this way, everyone who showed up today, because I think having spaces like this is so important to help break through that. So if we could go to the next slide. So I want to give a moment, you know, I've talked about a lot so far. And so before we move into the next portion of this talk, where I'm going to give you some real concrete strategies to start to address imposter syndrome and start to navigate it in your life. But before we do that, I wanted to give a moment to just pause and reflect. And so how have you seen this played out in your life? And what is your experience with this? What's coming up for you right now? What so far out of what we've talked about has resonated with you, and in what way? So if you have a pen and paper, you can jot it down for yourself. If you feel comfortable leaving it in the chat, please do. And I'm going to give you about a minute or so to just pause and reflect on that. And I'm going to go through the chat as well to kind of catch myself up on the chat. But I want to give you a minute to really pause and reflect on these questions.
I've also enabled the annotation feature. So for people who want to just dabble and draw and are visual learners like me, if you want to stamp or put text or just like put some words around that too, it's kind of a less frightening way to share than like unmuting yourself or having to put something in the chat too. So I've enabled the annotation feature if people want to play around with that.
So I'm seeing a couple of things in the chat that I will be addressing in this next portion. One thing that really stuck out to me, though, is this fear of success tied to my immigrant identity and not wanting to show up people or draw attention to ourselves.
And yes, there is a question. Sorry, Dr. Ajmani, there's a question in the chat. Are we being invited to write or share out loud? Yes, if you want to write, you're completely welcome to write. If you want to share out loud, I'd love to invite people to do that as well. We do have 30 minutes left, and we had some community Q&A time at the end. So if you did want to share your experiences, you're completely welcome to.
Yeah, for coming off mute, I would say if we could do that at the end, but otherwise right now, go ahead and use the chat box. And then, yeah, the one about showing up though and drawing attention to yourself. You know, I think one thing that's coming up for me with that, gosh, that can be so hard. But one thing that I feel like I've noticed is a lot of time when we do that, it actually ends up inspiring others and inspiring others to do the same, which is interesting. And I see another question in the chat box. We'll get to that as we move into this next section with some tools. So the question is, how do you consider the lack of self-esteem with imposter syndrome? So we're going to work through some of that here in this next section. So let's go ahead and move on to that now. If we could go to the next slide. And what we're going to do is we're going to go through some different strategies, concrete tools to help you address imposter syndrome. So first of all, I just wanted to mention again that idea of overcoming versus addressing imposter syndrome, right? Thinking of it as maybe not, I'm going to relate this to kind of a different analogy that I've heard before that I like, which is just about fear in general, right? That fear is always going to be there. And actually, I read this in Elizabeth Gilbert's book, Big Magic, that fear is always going to be there, but fear is not going to, I'm not going to let fear drive the car. Fear can take the back seat, but it's always going to be there, right? And I'm kind of just thinking about that with the imposter syndrome, with what I had shared earlier, that we're continually growing, continually making progress. And so maybe this isn't something that we 100% overcome, but we learn how to navigate and address it, right? And how to continue to move forward despite these feelings that kind of naturally come up as well, yeah? And so one way that I wanted to start off talking about some of these different tools and modalities, and what we're going to do is I'm going to go through a whole lot of like everything on this slide, kind of helping brainstorm different ways to help you address it. And then I'm going to invite you to choose one of those to work on for the next 2 to 3 weeks within your own life and just see how that feels for you. So first I wanted to talk about this idea of Ayurveda. So I did not mention it in my intro, but I'm also a certified yoga instructor and a certified Ayurveda lifestyle consultant. So I bring these approaches into a lot of the work that I do when I'm working with clients. And Ayurveda, if you're not familiar, is it's technically the ancient medical system of India. And really what it does in terms of the philosophy and the approach of it, it really sees each individual as completely unique. It says that we are all born with a very specific constitution of physical, mental, emotional qualities, tendencies, and factors. And these specific qualities, right? These qualities, what we may perceive as our strengths or our quote unquote weaknesses, we were born with these for a reason. Yeah. And it's different for every single one of us. And we were born with this specific set of qualities for a reason. And that reason is to fulfill your unique purpose in the world. Right. And so if instead of seeing some of these maybe quote unquote differences or quote unquote what we may perceive as weaknesses as things that are holding us back, can we start to embrace some greater self-compassion, some self-love that, hey, this is all what makes me me. And this is all for me to serve a specific, unique purpose in my life. And it's okay if you don't know exactly what that purpose is right now. You don't have to have that all figured out. But I think that can help with these feelings of imposter syndrome, because it allows you this framework to start to embrace all the aspects of who you are instead of feeling afraid of being found out for some of these aspects of who you are. Yeah. And Ayurveda then gives us a framework that addresses all of these different areas that you see on the slide here of ways to sort of address this relationship that you have with yourself. And so I'm going to go through some of these now, and I'm going to go through and just give you some examples of different ways and tools and modalities that you can begin to address imposter syndrome. And again, I'm not saying that you need to do all of these. So please, I'm not going through all of these to overwhelm you. So please don't feel overwhelmed as I go through these. I'm going through all of these to give you options, right? To give you options. As I said, Ayurveda sees each individual as completely unique. And so what works for you may be different than what works for Sophia, might be different than what works for Angel, and that is completely okay. So it's nice to have options. I always talk about kind of filling your toolbox with different tools. So that way, when you need it, it's there and you can pull it out, right? So let's go kind of sort of big category by big category. So starting with the mind, what are some ways with regards to just our mind that we can begin to address imposter syndrome? So one thing is self-talk and affirmations. What does your inner dialogue look like? What does your inner dialogue look like? I'll be honest, I don't think I even really thought about this, about my inner dialogue, or was even aware of my inner dialogue, maybe until like my early 30s, right? So, but being aware of your inner dialogue is the first step. So just having some self-awareness, whether it could be something like through a mindfulness practice or meditation practice, or just noticing where your thoughts are going. And then noticing, is that inner dialogue one of self-judgment, self-criticism, or is it a loving, nurturing dialogue? So that's step 2. First is just noticing it. Step 2 is, what sort of thought is it, right? And then letting go of judgment of that too, right? So what I mean by that is, if you're noticing it's a harsh or critical thought, rather than adding fuel to the fire of, oh my goodness, I shouldn't be thinking of that, right? That's just adding more judgment to it, right? Just noticing it, okay, well, that thought leads me down this downward spiral that really doesn't feel good. And so instead, I'm going to intercept that. And a way that you can intercept that is through an affirmation. An affirmation. What do you affirm to be? I am confident. I am peace. I am whole, right? These are all just examples of affirmations. So that's one way. Another one is accepting compliments. So that was something in the chat box as well that actually a couple of people mentioned, I believe, of being able to accept compliments. And again, we're often, this, particularly culturally, we are often taught to be humble and deflect those compliments. Or, as I mentioned earlier, attribute those compliments to something outside of ourselves. Oh, that was just luck. Oh, the stars just aligned in my favor that day, or whatever it may be. But what if we just said, thank you, when someone gives you a compliment? You don't need to justify it or go into a long thing about it, but just thank you and let yourself feel it in your heart. Yeah. And then another way is to celebrate your daily wins. This is something that I often talk about in my my signature program as well, is celebrating your daily wins, because so often at the end of a day, it's so easy to look back on your day and think about, maybe even perseverate over all of the things that you didn't get to on your to-do list, all the things that you didn't achieve, or that you didn't feel like you did good enough, right? But what about all the things you did achieve? What about all the things you did do, right? Taking a moment instead to maybe kind of flip that script and thinking about all of the things that you did achieve, all the things that you can feel proud of yourself for at the end of that day, right? So one way that you could do that is, just one option of a way that you can do that is to have like a little journal just on your bedside table. And at night, before you go to bed, just jot down like 1 to 3 things, like what could I feel proud of, or what went well today? Just ask yourself that question. What can I feel proud of? What went well today? And I see a question here of how do you believe the affirmations you say to yourself? When you start working with affirmations, you're probably not going to believe them. In fact, you might use them for months and not believe them for years. But it's a practice. It's a practice, right? And so as you begin to do it more and more, it starts to become second nature. So I've been practicing this for over a decade now. And I'll say it was hard at first, but now, more than a decade later, it's almost second nature, almost, right? I'm still human. I still sometimes go on those downward spirals, but most often I'm able to intercept it a bit quicker with that affirmation. And it's almost just like a trigger, like the negative thought comes, the affirmation comes immediately after. But it took a while. It's taken a while to get there. And one of the reasons that it is so hard is because we are so conditioned with that self-talk, right? I mean, if we've been talking to ourselves, like I mentioned for myself, I don't think I was even really aware of this until I was like 30. And so that's 30 years of talking to myself a certain way. And now I'm trying to change that. Like, it's not going to happen just like that, right? It's going to take time. It's going to take practice. And it's not only your self-talk, but some of that self-talk may be from things that you have, like a lot of the things we've talked about earlier, things culturally that we've been taught, things that we heard in our families, things that we've experienced through interacting with our external environment, through things like those explicit or implicit biases or microaggressions that all may be contributing to that self-talk as well, right? And so it is a deep process. It is working through all of that in this practice of intercepting that inner dialogue and replacing some of those negative thoughts with affirmations. And I always like to say with that too, though, that you're not discounting those quote unquote negative or hard thoughts, right? There's this phrase that came about or became quite popular a few years ago of toxic positivity. And I always like to bring that up when I'm talking about our inner dialogue and affirmations, because that's not what this is. It's not saying discount that and just be positive. What's it saying is notice that, but notice that downward spiral, where that takes you and how that feels, and saying, I know that's there. I've experienced that, and I don't want to go down that road again. This makes me feel better, right? It's just all about how you feel about yourself. Right? So it's not discounting or invalidating any of that. I think that's a really important point. It's honoring it. It's saying that can exist and this can exist, if that makes sense. So moving on to emotions. So with emotions, and some of the things I talked about with mind will obviously affect your emotions as well. But specifically with emotions, I wanted to bring up a couple of other ideas and options. And so one of that being gratitude. Gratitude practice is so, so powerful. Eckhart Tolle says that gratitude is the root of all abundance, right? When we're in a state of feeling really grateful, it's yes, you can feel other things, of course, as well. But when you are feeling really grateful, you enter into this state of abundance as opposed to lack, right? The other thing I wanted to mention is this feeling of nervousness that we can often feel, right? When we're feeling some of these signs of imposter syndrome, we may feel nervous, right? Nervous, fear of being found out, anxious, all of that. And I love this reframe that nervousness is just an energy, and it is the similar energy as excitement. And so I use this one myself quite often when if I'm feeling nervous about something. I'll just ask myself, am I really nervous, or am I just excited? Am I just really excited? Yeah, so that can be a helpful little reframe there, because it's the same energy. And then the other one is keeping a hype folder. So I love this one. This is the one I actually first heard about it maybe like 5 or 6 years ago. And basically what it is jotting down or keeping a folder, maybe on your computer or a journal, of all of the positive things, right? So I can share a little bit about how I've used it, right? So when I've had patient interactions that, a parent has told me just how, just the difference that I've made in their child's life or their family's life, right? Just jotting that down real quick, right? Or when I've worked with a client and they send me an email afterwards, just sharing the impact that our work together has had, I put that email into a hype folder in my email box, right? And so that way, when you are feeling these feelings of imposter syndrome, you have this folder or this journal that you can go back to, that you can pull out and you can look at, and you can just remind yourself, like, here's clear, concrete evidence of my experience, of my skills, of my impact, right? So that it's not just like you're like, it's not like you're making it up, right? Like, we all, like, ideally we're able to give ourselves that internal validation, right? But we're also human, like, and we engage with the external world around us. So sometimes that external can be helpful. And when you have it here in this hype folder, easy to access whenever you're kind of feeling that way, that can be really helpful. And then body. So getting to your body can be a powerful way as well. So power pose, right? I'm sure we all know that. I don't think you can see me fully, but power pose, right? You stand like that for 2 minutes. Studies show that it increases your testosterone and decreases your cortisol, your stress hormone, which makes you feel more confident, more ready, and more able to take action. Yeah. So that's a way, that's a practice that you could do, you know, every day for 2 minutes, just stand in power pose. Another way is just movement, right? Movement is such a great way. So emotion comes from Latin for emovere, which means to move out. Emotions, when you feel that fear or anxiety around imposter syndrome, they're meant to move through you and out of you. And so movement is a way that you can do that. So whether that's like, oh, I'm really feeling this way, I'm just going to get up and go for a walk, or I'm going to put on a song and dance, right? All of those would be great options. So just kind of getting into your body. And then the last one I have here, the last category I have here is relations, like relational. And that's like exactly what we're doing here, right? A lot of times when you're experiencing imposter syndrome, it can feel like you're the only one. And you're not, right? And that's what I love about having spaces like this, where we can all come together and actually just talk about it. You are not alone in this experience. And I think just knowing that can often be really, really helpful as well. So I just gave you a huge list of sort of how-tos and different options to begin to address imposter syndrome. So what I would love for you to do, and what I invite you to do, is pick just one of these things, either one of these things that we talked about, or it's possible that one of the things that we talked about maybe brought up something for you in your own mind as another idea to work with, to begin to work with in your life for the next 2 to 3 weeks. And I suggest just picking one. One of my core principles in Radiant Living and Radiant Living Institute and working with clients is that small changes make a large impact. So I always invite you, again, because going back to some of the things we talked about here, right? We have this tendency towards perfectionism, towards all or nothing, towards overworking, over preparing, right? And so we don't want to continue to contribute to that in this way to address it. So pick one, pick something small to start to work with. What happens is, specifically with things like this, when you begin to work with something small, it's more likely to become a habit, because when you pick these small goals that you're only going to do maybe for a minute or 2 minutes a day, let's just say like the power pose or gratitude, or just jotting down your wins at the end of the day, what happens is it's because it's a sort of a smaller commitment, you're able to kind of commit to it more often, and you start to notice how good it feels, and it's more likely to become a habit, if that makes sense, as opposed to if you were like, I'm going to do every single thing on this list, right? And then what can happen is we miss a day or 2 or 3, and then we have that all or nothing mindset, like, well, that didn't work, and there's no point in me starting now. But when we start small, it's more likely to stick. And like I said, this is a toolbox. So what you can do is try one of these tools for 2 or 3 weeks, see how it feels, see if you're noticing a difference. If you are, great. If you're not, pick something else from this list to try for the next 2 to 3 weeks. Yeah. So go ahead, jot it down either on your notes or in the chat box, what you will plan to try. And then we can move to the next slide.
Perfect. We probably have time for one question if someone wanted to go off of mute. We have about 10 minutes left in the hour. Wanted to leave some time for Sophia and Asian Women for Health to wrap up. So probably one question if someone wanted to ask Dr. Ajmani.
Actually, I just saw this, well, while people are maybe typing a question, I saw this one of my best affirmation lately is my dog loves me, so I must be worthy of love. So that reminds me actually of something that I did, the story that I shared to you earlier when it was my intern year, and it just felt so hard for me. It just felt so hard in so many different ways. And one thing that I often said was, even if I don't feel confident or feel like I can do this, I know I can. And I know that there are all these people who know that I can. There's the people on the med school admission committee. I wouldn't have gotten here if someone didn't think I could do this. The people in the residency admission committee, right? Faith is a big part of my life. So that was something I would say, you know, if I'm here, that means God knows I can do this. Right. And so that can be a really helpful, and your comment there reminded me of that. And I wanted to share that with you. Again, you know, ideally we're able to bring all of that, come to a place where we maybe don't need the external validation, and we can have it all internally. And yet we're also all human, and we live in this social world, and relationships are important. We are relational beings. And so, so using what helps, you know.
Thank you so much.
Mm-hmm.
All right. If anyone wanted to ask a question, now would be the time. If not, I'm actually going to share Dr. Ajmani's contact information as well as the link to her website. So if you would feel more comfortable emailing Dr. Ajmani, learning more about her program, participating in some of the work that she makes available for the public, that's a great way to do that as well.
Yes.
And
oh yeah, I was going to say, yeah, and the next slide has my contact information as well, but we'll put it in the chat as well. And I really do absolutely welcome hearing from you. I always love to hear from you. So feel free to shoot me an email, use the contact form on my website, or just connect with me on socials. I'm not on TikTok. I think that's the only like main one that I haven't jumped on the bandwagon for, but otherwise LinkedIn, Instagram, Facebook, feel free to send me a DM, and also feel free to take a look at my website. My signature program, Reclaim Your Radiance, is a 6-week journey that combines a lot of the things that we've talked about today. And then I also have a podcast, Essential Self-Care, that's on Apple, Spotify, and Google Podcasts.
Lovely. Just wanted to wrap up and kind of transition us back to the rest of our day and the beginning of the weekend. So why have we gathered here today? One of the things that Dr. Ajmani brought up was the intersection of culture. And I wanted to highlight a theme that came up in today's workshop, which is the importance of culturally informed care. We see at Anise Health, we see culturally informed care as one that intentionally acknowledges, welcomes, and addresses the impact of social and cultural factors on a person's well-being. It means seeing people more than just a set of symptoms and diagnoses, but seeing patients and clients as unique individuals whose racial and cultural context shapes how we experience the world, kind of as Dr. Ajmani said about Ayurveda principles. And so we embed this in how we do culturally responsive care at Anise. So just to share a little bit about the platform, Anise is uniquely differentiated from a lot of the other like mental health platforms because we are a monthly program that integrates therapy and coaching in weekly sessions. So you would get a dedicated care team of both a therapist and a coach for weekly sessions. So how it works is people go to our website, they fill out an intake form, takes like 7 minutes. Within 2 business days, you'll get matched to a set of recommended therapists. You can do a 15-minute free trial call to see if there's chemistry and trust with the therapist. And then you book your first month of programs. The first month for 3 weekly sessions of therapy and 1 of coaching is currently priced at $250 for the first month. On October 1st, that is rising slightly to $350 for the first month. So I will just let everyone know that if you actually sign up in the next 2 days, you will be able to get locked into our current prices. We accept HSA and FSA benefits. We're in network with 2 insurance clients, currently negotiating with 6 more, including Aetna, Blue Shield, Anthem, Evernorth, Magellan, Humana, and a few more as well. And then in addition to getting a therapist and a coach, you get access to a curated digital resource library of videos, articles that bring in non-Eurocentric, non-Western approaches to holistic healing as well. So with that, I'm going to share this discount code for $25 off your first month. Also, Dr. Ajmani and I just wanted to know what you thought about today's session. So this is a feedback form where you can just let us know what you thought. And then we will be randomly selecting some respondents to win a copy of Parents Are Human. It's a card game with prompts that you can play with your families to encourage deeper conversations. So with all of that, I wanted to give some time back to Sophia to talk about some upcoming programming as well.